afternoon and welcome to our media briefing. We know the last few weeks have brought a lot of change as we begin to reopen businesses and aspects of our civic life. And while it's exciting to see more things open, we want to remind people that we are still in a pandemic that is hitting our state particularly hard. So we want to remind everyone that even though San Diego is reopening, we need everyone to continue to take necessary precautions. And one of the biggest things you can do to protect yourself and others is to wear a facial covering. Now, I know it's a pain. I've seen and heard comments from people who are tired of wearing facial coverings. But I want to remind everyone that there is still no cure for COVID-19. This is a contagious disease, and studies have shown that the use of facial coverings help slow the spread of the virus. Yes, summer is here, and the weather is heating up, and that can make it uncomfortable to cover your face. But if you think about it, covering your face is one of the easiest things you can do right now. We're not asking you to cover up all the time. You don't have to cover up when you're at home or driving in your car alone. All you need to do is to take a face covering with you when you go out and use it when you're around other people. So please, cover your face. Another good way to help fight this pandemic is to get tested. And today, we can announce 2 new testing sites in Spring Valley and Mira Mesa. These locations join our growing and robust network of sites throughout the region, about half of which are located in South County, which has had a larger number of cases than other parts of the region. If you need help making appointments to get tested, please use the new website that makes it very easy to find a test site or make an appointment for testing. The new site, developed in partnership with 211 San Diego, is on our coronavirus website, which we promote right here on this podium. Your visit to the website, when you visit it, go to the testing area on the front page. On there, you have the option of finding a test site by putting in your location or by the date you want to get tested. You can also go to 211sandiego.org for the same information. I encourage you to seek testing for yourself or your loved ones, and remember, the testing is free. And once you make an appointment, please stick to it. We don't want to pass up a life-saving opportunity. So now to get to the numbers and the latest data, let me call up Supervisor Fletcher.
Thank you, and good afternoon. We will get to an update on the numbers in just a minute. But our numbers in San Diego County related to cases, hospitalizations, and ICUs remain relatively stable. They remain relatively flat. We've seen day-to-day increases, day-to-day decreases, but across the board have been generally flat, which is a testament to the community support and actions and the general adherence to the things that we put out. But it is important for us to continue to remind each other that the danger from coronavirus remains real. And in some ways, as we have more folks going into more places, particularly indoor places, the danger of spread and transmission has certainly increased. And that's why we continue to reinforce the need for face coverings, for physical distancing, for all of the various components that we've outlined that are vital. If we do those actions and we have a more widespread testing, tracing, and treatment components, the hope is that we can fight the spread of coronavirus and keep it at a manageable level. And the reality is not every state is having the success that California's having. You're seeing multiple states around the nation that are seeing significant spikes and surges. Many of those are places that begin their reopening process earlier than we did here in California. But even in California, we are seeing a number of counties, many of whom were on similar timelines to us, that are seeing significant increases in cases. In the past 3 days, 5 counties across the state have experienced a more than 10% rise in patients with COVID-19 and their hospitalizations. Contra Costa County has a 13% rise, Kings County 18%, San Joaquin 12%, Santa Barbara a 27% rise, Stanislaus County, a 42% increase. Ventura County has been particularly hard hit. Last week to this week, they've seen a 75% increase in their hospitalizations from COVID-19. Orange County has had a 76% spike in ICU patients with COVID-19 in the last 6 weeks. The rate of rise of hospitalizations is being attributed to a rise in places for people to transmit the virus. Now, it is not automatic that something that happens in one county or area or state is going to automatically happen here, but it is a powerful reminder to us all that the danger remains, and a powerful reminder to us all that we cannot lose the mindset and posture that gave us such incredible success at the outset. We want to see this through. We don't want to lose our will and our focus halfway into this and get ourselves in a bad situation, and so we continue to ask for the public's help and support. As a novel coronavirus, as we go through this, we learn a lot more. If you remember, at the outset, face coverings were not recommended. And then as more was understood and learned, we came to the realization that face coverings play a very important role in limiting the spread and transmission. We were one of a handful of counties in California to require mandatory face coverings, not out of a desire to inconvenience people's lives, but out of a desire to save life, out of a desire to slow the transmission, to slow the spread, out of a desire to facilitate our reopening. The U.S. Surgeon General recently commented that masks don't take away your freedom, masks provide you freedom in terms of the ability to get back out, to open things up, and to move forward. And so we continue to believe strongly, and every day that goes by we get more evidence to suggest the utilization of face coverings is a vital and critical component of slowing the spread of coronavirus. And so while it is inconvenient, it is a temporary inconvenience and a minor one compared to the potential impacts of spread and potential death. And so we continue to believe strongly that the utilization of face coverings, when you are within 6 feet of a non-household member, is an important part of our strategy, and we continue to ask the public's continued help and cooperation. We know that it may not be convenient, it may not be nice, but if a ICU nurse can wear it for a 16-hour shift, then I got to believe we can put it on for 16 minutes when we walk in the grocery store to pick up something. And so again, we continue to ask for the public's help and cooperation. Before I get to the numbers, I want to address testing. We have seen a pretty significant jump in the last week in terms of our testing. As we've ramped up testing, it's been well documented since the outset of this when we were doing just a handful of tests a day. We've covered a lot of the complexities and challenges surrounding testing. The fragmented nature of our healthcare system, the global demand for the same number of machines and components and swabs and reagents, the need for PPE, arranging the way for people to get tested. And it is challenging, not just for us here in San Diego, but for everywhere in the world that is trying to significantly increase testing. And we have done a very good job as a county in terms of ramping up and increasing our testing. We are grateful for our health system partners that continue to do testing. We're grateful for the state of California in providing the drive-up testing services. I'm very grateful for our incredible staff in our public health lab that have worked around the clock to try and significantly increase the testing there. It is natural as you go through this, you're going to have hiccups, you're going to have reporting delays, you're going to have machines that break, you're going to have to continue to work through things. And we in San Diego County have certainly had all of those experiences, and we have continued to work through them. And over the last, say, week, we've been catching up a backlog of some state reporting tests, a backlog that developed because of a machine that broke. And when those instances occur, we come up with a new plan. In one instance, we called Scripps Hospital and said, hey, can you help us? We have a machine down. Can you help us run some of these tests? And they were willing to do it. We've leaned on commercial partners. We've ordered new equipment. We've got new staffing. We've gotten back on track. And so we do think that the results that we're presently in right now are probably artificially a little bit higher because of some of those backlogs in reporting and testing. We think maybe the preceding weeks were a little bit lower. Next week may come down to stabilizing. But we will keep breaking through every barrier that we face in terms of having widespread testing and availability of results as quickly as we possibly can. And I'm very grateful for all of the folks, both in our public health lab, our hospitals, commercial labs, the state of California, that are all coming together to rapidly and quickly put in place very complex systems to ensure that as many San Diegans as possible can get tested every single day, and to make sure we can get those results as rapidly as are humanly possible. And so with that, let's jump into our T3 chart here. You see a really significant jump in testing, 6,782. Again, some of this is a backlog and catch up of some of it. But again, you can see our 7-day average there at 5,820. Significant jump there over our initial goal of 5,200. And we will continue to strive to have more testing, but we're approaching 250,000 total tests in San Diego County, which puts us in the top tier per capita of counties in California. Contact tracing, you see 481 over the initial goal of 450. Again, that doesn't mean we won't need more folks. It doesn't mean we aren't actively engaged in hiring and bringing on board more folks. But as our testing increases, our contact tracing will increase proportional so that we can make sure we're tracking down all of those close contacts and rapidly identifying every positive as quickly as we can to get them isolated. And then, of course, our public health motel rooms remain for those who cannot isolate at home. For today's positive, we're reporting 124 new positive tests out of, again, our 1-day high of testing. That gives us a 2% percentage of total tests positive, which is a little below our 14-day rolling average of 2.9. Our hospitalization census, again, relatively stable. Our ICU utilization is up a little bit from yesterday. Our non-ICU utilization is down a little bit, but holding generally stable. And then on the next chart, you can again see what I referenced at the beginning of my remarks. COVID hospital utilization, non-COVID, still there right around the 4,000 mark, which was about where we were a month ago, with about 800 rooms between that and the 80% occupancy trigger. And then the final one here is ICU utilization. You see the COVID-related ICUs there at the bottom, non-COVID ICUs up just about 17 from yesterday. Again, ICU occupancy at about 64%, which again, you see that kind of rolling up and down, but generally staying in the same range. And again, that is encouraging, but it's a reminder that hospitalizations, ICU utilizations, these are lagging indicators. These tell us what happened sometime in the past. And so we need to be mindful that as we have more folks out and people are more engaged and going into more settings, we really have to be mindful to guard against the actions or lack of actions that might contribute to a spike like we've seen in other counties. We certainly don't want that to be the case here in San Diego County. That concludes my report. I'll now turn it over to Dr. Wilma Wooten for a public health officer's update.
Thank you so much, Supervisor Fletcher, and welcome everyone, and thank you for being here today. Global, national, and state statistics are based on the data that we retrieve from the Johns Hopkins dashboard and was obtained today around noon. Globally, there are almost 8.3 million positive cases, including almost 446,000 deaths. Nationwide, the United States is reporting over 2.1 million positive cases, now at 26% of the global number, and includes over 117,000 deaths. Statewide, California is reporting over 159,000 positive cases, which is 2% of the global number, and includes 5,203 deaths. Today, the County of San Diego is reporting 9,854 cases, which is 124 more cases than reported yesterday, and includes 327 deaths, which is 4 more deaths than reported yesterday. The age range has not changed from 3 months to 102 years of age. Gender is the same, 51% female. 53% of the total number of cases are between the ages of 20 and 49 years of age. Of the 9,854 cases, race and ethnicity data is available for 8,201, or 83% of all cases, and include 67% Hispanic or Latino, 21% white, 6.3% Asian, 3.6% Black or African American, 0.8% Native Hawaiian or Pacific Islanders, 0.8% individuals of multiple races, and 0.2% in American Indian or Native or Alaskans. And 1,653%, or, I'm sorry, 1,653, or 17%, have no race or ethnicity data provided. So regarding hospitalizations, 1,562, or 16% of the total number of cases have been hospitalized. And of that number, if you can move to the next slide, thank you. And of that number, 435 of the total number of cases have been admitted to the ICU. This number is 4% of the total number of cases and 28% of the total number of those hospitalized. And as of June 16th, the county has surge capacity for hospitalization at 34% and for ICU admissions at 36%. Now, of the 327 deaths, these represent approximately 4% of the total number of cases. Of the 4 new deaths reported today, the age ranges from high 60s or to high 80s, and the deaths occurred between June 7th and June 13th. Of the total number of deaths, 43% were female, 57% were male, and 311, or 95% of the total death cases had underlying medical conditions. 15, or 5% of the total deaths had no underlying medical conditions, and 1 is still pending. Now, regarding race and ethnicity of all deaths, we have data for 98%, or 322 of the 327 total number of death cases. Of this total for which data is available, 139, or 43%, or Hispanic or Latino, 133, or 41%, are white, 40, or 12%, are Asian, 9, or 3%, are Black or African American, and 1, or 0.3%, is Native Hawaiian or Pacific Islander. And our sincerest condolences go out to the family and friends of those individuals throughout the pandemic who have lost their lives, and especially to those that have been reported here today. Now, a Centers for Disease Control and Prevention analysis of 1.3 million cases reported from January 22nd through May 30th this year was released earlier this week. It indicates that hospitalizations were 6 times higher and deaths 12 times higher for COVID-19 patients with reported underlying conditions. Locally, hospitalizations were 5 times higher and deaths 20 times higher for COVID-19 patients with reported underlying medical conditions. The study reported also that the most common underlying health conditions were cardiovascular heart disease at 32%, diabetes at 30%, and chronic lung diseases at 18%. Typically, that would be COPD or asthma. Locally, among all of the San Diego County COVID-19 cases with known information about underlying medical conditions, 23%, if you can go back to that slide so people can compare national with what I'm reporting locally. Locally, 23% had cardiovascular disease, 15% had diabetes, and 10% had chronic lung disease. Of note, the 18% COVID-19 cases in this state. In San somewhat of a downward trend with the exception of the 2 weeks, the second and third week in May. And that may be related to cases that we were receiving from Imperial County as well as Tijuana and Mexicali. Next slide. This slide shows deaths, and again, pretty consistent over the past 2 weeks. And so this slide just basically helps to keep us aware of where we are and how we are trending. Next slide is the triggers. So this slide helps us to stay on track and know where we are with our various triggers. As I've already stated, we have 6 community outbreaks. Our target there for sounding the alarm is 7, but even before getting there, we're looking at the types of outbreaks. So we've had 2 outbreaks in residents, 2 outbreaks in restaurants, 1 in a residence, and then the others are in businesses. So our role here is to increase communication. As with any outbreak, we have staff going out to the restaurants to conduct an inspection for prevention and control, to make sure that all of the parameters are in place. And these parameters are strategies. There are 4 primary strategies, whether you're a business or an individual. Those are to practice safe or hand hygiene as well as sanitation. The second is to maintain physical distancing, and the third is facial coverings, as Supervisor Fletcher has talked about. And the last is to conduct screenings, which include temperature checks as well as symptom checks where appropriate, and as provided in our state guidelines in this health officer's order. So for the triggers again, all green here, we are seeing, as I stated before, uptick in the community setting outbreaks. Now, the past 7 days that we are concerned with here is from June 10th through June 16th. And every day, a day will drop off. So we will conduct the strategies and the actions that I have already spoken of. I think that concludes my report, and I would just like to remind everyone that everyone has a role to play, and we want everyone to take action to follow those 3 strategies that we have reviewed, and curtailing and preventing an uptick in new cases really depends upon all of us, and particularly you and the public, as more freedom is made available to you and businesses begin to open up. So again, thanks to all of you. Thanks to our business, to individuals and organizations that are opening up and complying with the recommendations in the health officer's orders. Now, please welcome back to the podium Supervisor and Chairman Greg Cox. Thank you.
Okay, we'll go right to the questions.
Jennifer Kastner with ABC 10 News. Please state your question.
Hi, good afternoon. Thanks for taking my call. This is in regard to mentioning of the uptick in the new community outbreaks. Can you please go over again the number and nature of those new community outbreaks? And also, is the county aware of a party last week involving roughly 30 college-age people in their 20s where there was little to no mask wearing or social distancing, and subsequently resulted in 10, maybe more than 10 people contracting the virus?
Okay, Dr. Wooten?
So again, of the 6 community setting outbreaks, 1 is in a private residence, 2 are in restaurants, and the remaining 4 are in various and sundry types of businesses. No similarity in the businesses, just the sheer fact that they are work sites. So that is the number of the 6 businesses in the past 7 days from the 10th through the 16th. Was there any, and the second question was related to the specific. There might be many events or gatherings throughout the county that occur at people's homes, and there's no way for us to know about all of those unless we get an email specifically related to a location with a specific address. So I'm not aware of the specific location. Actually, I don't know the location, but the specific event that you noted. Thank you.
Okay, let's go to the next question.
Lindsay Pena, also with ABC 10 News. Please state your question.
Yes, I believe this question would probably be directed to Dr. Wooten. We know that seniors have been told to still stay as vigilant as ever, stay at home as much as possible, but in talking to a lot of seniors myself, I guess how realistic is that for those that live on their own and that have to continue with daily tasks and just life until we know more about this virus and there might be a vaccine or any type of solution for them? I guess, what are your recommendations for seniors right now who are still scared and still very isolated at this point?
Okay, Dr. Wooten.
Well, I can tell you that the recommendations have not changed. We, since the beginning, have strongly recommended that our seniors stay at home and only go out for essential services. Having, whether it's family or friends, family and friends can still visit the seniors. You've seen a lot of examples on social media where grandchildren or friends come to visit them, maintaining that 6 feet separation. The state, as well as the county, participates in meal programs that provides meals to seniors. So I think it is a bit, people don't have to shelter in place and not go outside. That's not what we're asking people. We're asking people to stay at home as much as possible and only going out for essential services, whether it's going to the grocery store, the cleaners, or to conduct essential business such as banking. But do that with the guidance that continues to be provided, maintaining 6 feet social distancing and using a facial covering.
Okay, and I have a question, Dr. Wooten, from Mike McKinnon from KUSI News. How many people who have attended protests have been tested, and is everyone who gets tested asked if they've been to a protest?
I don't know the answer to that, and I don't think that that is a standard question. We have Dr. McDonald here. He's shaking his head. No, that is not a standard question. What has been recommended to individuals that have gone, pardon? Again, going back, the answer is no, that is not a standard question that's asked. What we have asked individuals to do is, if you've been involved in protests, is to get tested. So that's the recommendation that's been made to the public.
All right. Thank you, Dr. Wooten.
Well, that's it for today for our questions. And again, just a reminder, we will not be holding, excuse me, but updates will be sent to the media, and we will return on Monday at 2:30. Again, for ongoing information, we encourage people to visit our coronavirus website at coronavirus-sd.com. And so until next Monday,